Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month, I'm talking about recent media coverage of healthcare and how that should or should not affect healthcare leaders' priorities. In the last 6 months or so, efforts to repeal and replace the Affordable Care Act have been getting the lion's share of attention. On one level, that's understandable. New developments are happening all the time. The political environment is volatile, sometimes downright dramatic, and the stakes are high. That definitely makes for interesting stories. But on another level, this focus is doing a disservice to consumers. While all this drama is playing out in Washington, consumers are still getting confusing hospital bills. They're still struggling to understand the ins and outs of their health insurance coverage. And they're still very concerned about their financial responsibilities for health care. A new study found that 1/3 of breast cancer patients are more scared about paying for treatment than they are of the cancer itself. Consumers want to know what their financial responsibilities will be. They don't want any curveballs. Those are reasonable expectations. Beyond that, consumers don't seem to think that they're getting good value for their healthcare dollars. That makes sense. Many of you have seen the international comparisons. America spends far more on healthcare than other high-income countries do, but we lag other countries on quality. That hasn't changed in the last 10 years or so, yet we've increased patient responsibility significantly during that time. No wonder consumers don't feel they're getting good value. For finance leaders who have put consumerism issues on the back burner, this should be a wake-up call. Some are heeding the call, but others not so much. If you've been following HFMA thought leadership over the past 10 years, you know that consumerism is a top priority for us. But I'm not sure that finance leaders look at it the same way. In fact, lately, I've been wondering if consumerism fatigue is setting in. Here's why I say that. First, price transparency is being written off in some quarters, prematurely in my opinion, for failing to reduce healthcare spending. Now, it's important for you to understand, I have never viewed consumerism as the cost silver bullet. However, that said, reasonable people would be hard-pressed to defend practices that keep consumers in the dark about their out-of-pocket expectations. Second, as I mentioned a minute ago, the focus on ACA repeal and replace has drawn attention away from consumer issues on a national level. And third, closer to home, the number of organizations applying for recognition as adopters of HFMA's patient financial communications best practices has slowed to a trickle. Healthcare stakeholders seem to be turning their attention elsewhere. At one level, I totally get it. There's so much going on. But ponder this. Should consumers pay the price for our busy agendas? The prognosis for our industry is serious. Consumers are losing trust in hospitals and physicians. For example, only 23% of people surveyed in a recent Harris poll believe that hospitals put patients over profits. 23%. All the advertising and public relations in the world won't change that. Financial anxiety and negative financial experiences must be dealt with directly. For providers, the first steps in regaining public trust is to ensure that patients are consistently treated with respect and empathy, receive timely and accurate price information, and know their payment and financial assistance options. Health systems must rebuild the relationships with consumers, and it starts with upfront discussions with consumers directly, business groups, community groups, and the media. The Patient Financial Communications Best Practices, available at hfma.org/communications, provide a roadmap for improving the patient financial experience. Let's use it. Thanks for watching. I'll see you next month.